Essential tremor is one of the most common movement disorders, yet for decades its treatment has relied largely on medications that weren't developed around a specific understanding of the disease mechanism. That's beginning to change. We are honored to be joined by Dr. Salima Brillman, a board-certified neurologist, movement disorders specialist, and founder of the Parkinson's Disease and Movement Disorders Center of Silicon Valley. Dr. Brillman has extensive experience treating essential tremor and other movement disorders, including the use of deep brain stimulation and emerging neuromodulation approaches. She has also participated in clinical research evaluating new therapeutic approaches for essential tremor. Today we'll discuss the unmet needs in essential tremor, the limitations of current treatments, and how a better understanding of tremor circuitry may be moving the field toward more precise, mechanism-based therapies. Dr. Brillman, essential tremor was historically even referred to as benign essential tremor. How accurate is the perception that essential tremor is a relatively simple, benign tremor disorder? As our understanding has evolved, are we also beginning to recognize that what we call essential tremor may represent a more heterogeneous disorder than we previously appreciated?
Okay. Actually, it is not a simple benign movement disorder at all. It really has a profound impact on our patients and on their lives, their quality of life. While it might start, as a small movement, it tends to progress and it can impact many facets of the person's life.
Tremor amplitude doesn't necessarily tell us how much the disease is affecting someone's life. A relatively modest tremor could have very different consequences for a surgeon, musician, electrician, or someone whose occupation doesn't depend upon fine motor control. How does essential tremor affect quality of life, employment, social interactions, and mental health?
So it certainly can have a profound impact on all of those facets. People are often stigmatized. I've had patients who work in retail, and they're often looked at as though they're on drugs when they're just trying to do their job. People tend to lose their jobs because of this type of thing, and they have trouble with things that we take for granted. Eating soup with a spoon or drinking a glass of water, and that leads to more social isolation and further mental health issues.
Do we sometimes underestimate essential tremor because we're measuring the tremor rather than the disability produced by the tremor?
Absolutely.
And should treatment goals therefore become more individualized around what each patient actually needs to be able to do?
Absolutely. The goal is really to have a person be able to function to the best of their capabilities during their activities of daily living and day-to-day life. So what that means for one person is different than the next person.
That brings us to an interesting disconnect. We increasingly recognize that essential tremor can be heterogeneous and profoundly disabling. Yet, pharmacologic treatment still begins with drugs that have been used for decades. How satisfied are you with current therapies such as propranolol and primidone?
Well, personally, I'm not at all satisfied with either of those, to be honest. Immediate release propranolol is the only one that's FDA approved for essential tremor. It doesn't last very long, and it can have side effects such as decreasing heart rate, making people tired, decreasing their blood pressure, and it's contraindicated in people that have asthma. Primidone has quite a few side effects, and many people are intolerant to utilizing the medication, so that limits their use.
When you start one of these medications today, how well can you actually predict whether an individual patient will respond? Are we still largely operating through therapeutic trial and error?
So in general, in my experience, a person is going to need at least 2 oral medications to even reach about 75% of efficacy with their improvement of tremor. That means a lot of side effects.
That raises a larger question about the limitations of the current treatment paradigm.
Definitely.
What are the major limitations of currently available therapies for essential tremor?
Well, the biggest limitation for these medications that are either approved or utilized off-label are side effects. And that limits the ability to increase the dose if needed, and it decreases the chances of having efficacy in controlling their tremor.
Is one of the fundamental limitations that we've historically treated the clinical manifestation, the tremor, without necessarily knowing enough about the specific physiology producing that patient's tremor?
Yes, the goal would be to get to the root of the cause rather than sort of, symptomatically utilizing something that's not specifically for essential tremor to help the essential tremor.
One of the most important advances in essential tremor may actually have come from procedural therapies. Deep brain stimulation and focused ultrasound demonstrate that intervening at particular nodes within the tremor network can dramatically change its clinical expression. How have deep brain stimulation and focused ultrasound changed the treatment landscape for essential tremor?
Well, I think because of the fact that they are surgical but very, very efficacious, it has been really an important milestone in treating this condition, particularly people who are very debilitated, that are unable to have independence because of their tremor. These modalities have really changed their lives.
Beyond their therapeutic value, what have these interventions taught us about the biology of essential tremor?
Well, it's taught us about circuitry and other means by which to go explore new avenues in the treatment of essential tremor.
Does their success reinforce the idea that precisely modulating the pathological circuit may itself be a form of precision therapy?
Yes, it does, absolutely.
This is where the future becomes particularly interesting. Essential tremor isn't yet like some cancers where we can identify a mutation, perform a companion diagnostic, and select a therapy directed specifically at that molecular abnormality. The biology isn't sufficiently resolved for that. But drug development is beginning to approach essential tremor differently. Instead of simply asking whether a drug suppresses tremor, investigators are increasingly asking whether a specific component of neuronal physiology contributing to pathological oscillation can be targeted. One example is the development of highly selective T-type calcium channel modulation aimed at abnormal neuronal burst firing within the cerebellothalamocortical circuit. That represents a different philosophy of drug development. Start with a mechanistic node in the pathological circuit and design the therapy around it. What gives you the greatest optimism about the future of essential tremor treatment?
Well, I think because of the increase in awareness of the importance of essential tremor, the fact that it is not benign, and how much it can profoundly impact a person's life, we have more awareness and therefore more trials, clinical trials, to try to find precision, precisely where the target could be and hopefully suppress it.
Do you think we're beginning a transition from empiric treatment toward precision neuroscience, where increasingly specific understanding of circuits, electrophysiology, phenotype, and eventually biomarkers helps determine how we treat an individual patient's tremor?
Yes, I do, and I think it's really important. Like I said before, it's very important to get to the root of the cause to be able to change that and improve their quality of life.
Perhaps the most important change in essential tremor isn't a single new drug or device. It's a change in how we're thinking about the disease. For decades, treatment was largely empirical. Diagnose essential tremor, try a medication, assess the response, and move to another treatment if necessary. The emerging model is different. Define the patient's phenotype, understand the pathological circuit, identify therapeutically controllable nodes within that circuit, and ultimately determine which intervention is most appropriate for that individual patient. We're not yet at the companion diagnostic stage of precision medicine in essential tremor, but we may be witnessing the transition that has to occur before that becomes possible, from treating tremor as a symptom to treating the biology that produces it. Dr. Brillman, we are so glad you could join us today. We look forward to our next chat.
Well, thank you for having me, and I hope that the work with education and problem solving for essential tremor continues, and we can help a lot of patients out there.